All right, today we're putting on our detective hats and stepping right into the world of high-risk obstetrics. We've got 5 different case files we're going to crack open, and each one is its own unique puzzle. Our job? To follow the clues the body gives us and see exactly how doctors make those critical, life-saving decisions. So let's jump right in. So let's start with this, an intense itch. We've all had an annoying itch, right? But what if during pregnancy, that simple itch isn't so simple? Could it be just a minor annoyance, or could it be a critical warning sign? What if it's the body's way of whispering that something much, much bigger is going on? This is our first clue. Okay, first up, we're diving into part 1, decoding the subtle signals. This is all about those quiet little hints the body gives us, the whispers that, if you catch them early, can make all the difference in the world. So let's open our first case file. Picture this, a 30-year-old woman, she's 37 weeks pregnant, so almost there, and she comes in with this unbearable itching. And get this, it's mostly on the palms of her hands and the soles of her feet. There's no rash, nothing you can see, just this crazy intense itch. So what on earth is going on here? And here's the answer. The diagnosis is Intrahepatic Cholestasis of pregnancy, or just ICP for short. That intense itch, well, it's basically an alarm bell for a problem happening deep inside with her liver. What's going on is that the normal flow of bile from the liver gets backed up, causing these things called bile acids to build up in her blood. And that's what triggers that maddening itch on the outside. Okay, so how do you treat it? Your first thought might be, it's an itch, just give her an antihistamine, right? But that would be exactly the wrong turn to take. It's kind of like hearing a smoke alarm, walking over and just turning it off, and then going back to what you were doing. You've silenced the alarm, but you haven't checked for the fire. The right call is a medicine called ursodeoxycholic acid, because it actually treats the root cause by lowering those dangerous bile acid levels. All right, so we've just seen a really obvious physical clue. But our next case file is the complete opposite. Here, the clue is totally invisible. There are no outward symptoms, nothing the patient would even notice. The warning sign is just a single number, hiding in plain sight on a routine lab report. And here it is, that one number, 130 milligrams per deciliter. This is her fasting blood sugar. Now, to you and me, that might not seem crazy high, but in the context of a pregnancy, oh yeah, that is a huge signal. In fact, this single data point is all you need to diagnose gestational diabetes mellitus, or GDM. Now, the management strategy here is really key. Instead of just jumping straight to medication, the very first step is all about empowering the patient. We're talking about lifestyle changes, modifying her diet, getting some exercise. The goal is to see if her body can manage the blood sugar naturally. It's only if that's not quite enough that doctors move on to medications like insulin or metformin. It's a really smart, logical progression. Okay, deep breath. We are shifting gears now. We've been talking about the body's whispers, but now we're moving on to the full-on, blaring alarms. In this next section, we're looking at acute crises, the situations where the clock is ticking and every single second is critical for both mom and baby. And case file number 3 is a full-blown crisis. I mean, just look at this. It's a whole constellation of alarming symptoms. We've got blood pressure that is sky high at 170/110, a severe headache, blurred vision, pain. This isn't just one little warning light. This is the entire dashboard flashing red. The whole system is in distress. The diagnosis? Severe preeclampsia. So in a crisis this intense, what's the first move? Your gut instinct might just be screaming, "Get the baby out, immediately." But that's not actually the protocol. And this highlights an absolutely core principle in high-risk obstetrics. You stabilize the mother first. You have to control the fire before you can safely evacuate the building. And here's exactly how that stabilization happens. Step 1. Immediately start an IV infusion of magnesium sulfate. This is crucial because it prevents the condition from escalating into eclampsia, which involves life-threatening seizures. At the exact same time, step 2 is to give powerful IV medications to bring that blood pressure down from those crisis levels. It's only once the mother is stable that they can move on to the definitive cure, which is delivery. On to case file number 4. We've got a patient at 30 weeks who is really struggling. She's getting more and more out of breath, she's exhausted, and an ultrasound of her heart, an echocardiogram, reveals the core of the problem. Her ejection fraction, which is just a measure of how well the heart is pumping, is only 30%. A healthy heart is typically up over 55%.
This is peripartum cardiomyopathy. It's a rare but very serious form of heart failure that is unique to pregnancy. Essentially, the heart muscle just gets weak and it loses its ability to pump blood effectively. So, in this case, the clue wasn't just how the patient was feeling, but that one critical number from the heart scan.
Our final case file is a perfect example of how even a really common condition like asthma can suddenly escalate into a crisis during pregnancy. Here we have a 28-year-old patient. She's had asthma before, but now at 22 weeks pregnant, it's taking a dangerous turn. Her wheezing is getting worse, she's coughing, and her breathing is labored. This is an acute asthma exacerbation.
Now, the good news here is that the treatment plan for this is really clear and effective. It's very similar to standard asthma care. The immediate first step is to use a nebulizer with albuterol. That's going to quickly open up her airways. If her symptoms continue after that, the next step is to add oral corticosteroids to reduce all that inflammation and prevent things from escalating to respiratory failure.
So we've just worked through 5 very different cases, right? We've gone from a subtle itch all the way to a full-blown crisis. So what's the common thread here? What are the big takeaways from all these medical puzzles?
Well, here's what it all boils down to. First, you have to listen to your body's signals, whether they're subtle or severe. An itch, a number on a lab report, it all matters. Second, getting the diagnosis right is everything. You have to treat the cause, not just the symptom. Remember the smoke alarm. Third, in a crisis, stabilizing the mother is always priority number 1. And finally, what we saw again and again is that management follows a logical, step-by-step process guided by protocols that are designed to get the safest outcomes for both mom and baby.
And that brings us to our final question. We've seen the power of diagnostics, of data, of medical protocols. But in the middle of all that, in the face of a medical challenge, what is a patient's most powerful tool? Maybe it's just awareness and the courage to voice every single concern, no matter how small it might seem.